want to please, I would like to make a request. Please rename your devices to names that we can relate with. Otherwise, we don't want to have unauthorized people be in the meeting and interrupt discussions. So please rename your device to avoid being taken out on suspicious accounts. Please rename your devices. If your display name is your phone, please rename it to a name that we can recognize, but also for purposes of us being able to know who joined the call. I'll continue with introducing Autism Care Uganda. I will start the session in a few minutes. Autism Care Uganda is a parent-led organization that seeks to provide support to parents of children with autism. We give them information about autism and help them interact with other parents with autistic children. We do have a WhatsApp group, which has proved to be a very strong support system for most of the parents that are in there, because they learn, they share, they ask for advice. So it has really been helpful. But also as Autism Care, we have a center that has a shop for supplements for autistic people, as well as a charity shop whose proceeds go towards raising awareness on autism. We have a therapy and diagnosis room as well for children with autism, and work with occupational and speech therapists to provide therapy. So please feel free to reach out to us if you need any of those services. Without further ado, I will just go ahead and introduce our panel today. We are thrilled to be joined by two talented speakers, and both of whom are medical doctors and passionate about issues of children and autism. Welcome to the session, Dr. Sabrina Kitaka and Dr. Prossy. I'll just give you some really nice information about the speakers. They're very well experienced. Dr. Sabrina is currently a senior lecturer in the Pediatrics and Child Health at Makerere University. She's a pediatrics infectious disease specialist, as well as an adolescent medicine practitioner. She has championed several healthcare interventions with a specific focus in pediatrics and adolescent health. She leads the training and advocacy efforts for adolescent healthcare at Makerere University. Her research interests are in infectious diseases, adolescent medicine, and immunization science, where she has over 30 peer-reviewed publications. Wow. She has supervised and mentored both national and international students at graduate and postgraduate levels. She also offers technical support and has been involved in policy development with the World Health Organization and the Ministry of Health in Uganda. Our goal is to see that every child and adolescent grows up to achieve their fullest potential. You're welcome. You're very much welcome, Dr. Sabrina. We are excited to have you on this session, and we can't wait for you to share your knowledge with us. I'll also introduce the second speaker. That's Dr. Prossy Nakanwagi. Dr. Prossy is also a medical doctor. She is an experienced project manager with a demonstrated history working in health research industry in various roles at site and sponsor level. She has earned a bachelor's degree in medicine and surgery from Makerere University, Kampala, and a master's of science in public health from International Health Sciences University, Kampala. She currently works at the drugs as the clinical project manager. Her past work experience includes working as a project lead at the Baylor College of Medicine Children's Foundation. Knowledgeable in good clinical practices guidelines, Prossy has further worked on HIV, TB and neglected tropical diseases, such as it's a long name, visceral leishmaniasis. In addition, she founded Caring for Special Ones, an online support community for parents and caregivers of people with autism. Amazing, amazing. I'm just blown away by the bios of our two panel speakers, guest speakers today. And I'm sure you're also excited to be hearing from them. Dr. Sabrina is going to give us a medical perspective of autism, and Dr. Prossy Nakanwagi will give us her experience as a parent to a child with autism. So we'll dive straight into our discussion, and we'll start with Dr. Sabrina Kitaka. So just to let you know the magnitude of the problem that we are talking about, and that's autism spectrum disorder. It is estimated that worldwide about 1 in 160 children has an autism spectrum disorder. That's a big number. And this estimate represents an average figure, and reported prevalence varies substantially across studies. Some well-controlled studies have, however, reported figures that are higher. The prevalence of autism spectrum disorder, which is also ASD, in many low and middle-income countries such as Uganda, is unknown. Yeah, we don't know the numbers. I don't think we have the I don't think we have the exact figures on autism spectrum disorder in Uganda, which is something that we also need to work on. Which this brings us to the big question: what really is autism? And our session today will help us understand autism spectrum disorder, its conditions, and the science. So to take us to our very first guest speaker, that's Dr. Sabrina Kitaka. We would like to know from your medical perspective, could you please help us understand what is autism? What are the signs of autism? And then how can we differentiate autism from other conditions? Dr. Sabrina, you're welcome to the discussion, and the floor is yours.
Good morning. Thank you for the invitation, Daryl, and I'm really glad to be here. In the next few minutes, I will be presenting things, and then you'll probably ask for clarifications. I'll switch off my video now for better concentration. So I work at Mulago Hospital and also at Baylor, Uganda, and I'm really happy to see Prossy here, Dr. Nakanwagi. Thank you so much for offering to share your views as well. I hope you can all see my slides.
Yes, we can.
So we know that autism is a developmental disorder, and the accurate diagnosis of autism requires a significant knowledge of the typical development skills. So the basics of autism include that parents may realize that their child is not developing normally by the age of 3 years, but we know that autism is a chronic lifelong course. The male to female ratio is estimated at 4:1, so it's estimated that there are more male than females. And sometimes there's an underlying neurological dysfunction, including delay of speech. There may also be seizures, and we know now that there are genetic factors as a causative factor, and there's a spectrum of severity. That's why it's called autism spectrum disorder. So basically, a child who has autism is not able to relate well with others. And also there's a failure to use language to convey meaning. And a lot of times there's an obsessive desire for the maintenance of sameness. A child may repeatedly do things, and a lot of times the child is anxious, and there may be a comorbidity, as I mentioned. There are 5 spectrum diagnoses on autism spectrum disorder. First one is autism disorder. Then we know there's Asperger's syndrome, there's Rett disorder, there's childhood disintegrative disorder, and then passive developmental disorder. So in terms of the autism spectrum, there are milder disorders like Asperger's. People with Asperger's syndrome have fewer symptoms. There's no language delay. And then there's passive developmental disorder. And then the other disorders include severe language delay, shyness, poor social development, and then rigidity and a focused interest in a particular area. Like I said, there are deficits in reciprocal social interaction, and a lot of times there's impairment in verbal and non-verbal communication. There's restricted, repetitive, or stereotype behavior and interests. So how can we confirm that a child has autism spectrum? First of all, there needs to be a demonstration of at least 6 of the 12 symptoms, at least 2 of the symptoms on the social domain. A child is not smiling by 6 weeks of life. A child is not able to respond to people they know, or a child has severe separation anxiety, or at least 1 symptom from the communication domain, i.e. a child is not able to speak by the normal age of about 2 years, or at least 1 symptom from the restricted behavior or interest domain. A child repeatedly plays with a toy or repeatedly knocks their head on the floor. And these are things that need to be observed. And all these symptoms should have been present before the age of 3 years. So what do we know about the autism spectrum disorder? First of all, like we said, it's a spectrum. There's mild to severe. Autism spectrum is not a rare condition. As you heard from the moderator, it can be as common as 1 in 160 children. And we now know that it's a developmental disorder. And it can be identified very early. So what symptoms were much more in common? There were children with autism spectrum disorder, and those times pediatricians described from 4 to per 10,000 people. Today we think it's about 1% of the population. If a child is born with autism, the likelihood of having a second sibling with autism is about 50% fold. So it increases by 10 to 20%. And there are possible explanations for us seeing more children with autism. The first one is, yes, we are now able to identify them better. We have better tools for diagnosis, and now there are even broader classification systems. But we know that the environment is changing, and it is possible that the environment has interacted with the human brain to result in more autism. Now, every child and adolescent deserves to reach their fullest potential. Each of us as parents would like to see our children grow up, become responsible adults, and become grandparents of their own children in a responsible way. I'm not going to bore you with the science, but this is a typical picture of the brain. The brain has a frontal lobe, it has a sulcus, it has a central sulcus, and the brain, generally speaking, is composed of two types of brain. The gray matter, that is the one responsible for emotions and reasoning, and then the
Dr.
white
Sabrina,
matter. Yes?
can I please interrupt just a quick, there's someone in the group who is saying you're moving fast. They would like to note down a few things. So it's becoming a difficult.
Oh, okay.
For them to put down the points. I would like to put.
I am going to share these slides with you. So if anyone would like this presentation, it would be nice for you to share your email so that the slides are sent to you. I'm trying to save on time. Thank you.
Okay.
So we know that the brain of autistic individuals has for a long time been suspected to be larger than those who are not autistic. And there's recent work by Cochin in 2003, which demonstrated that at birth, children with autism had smaller heads than non-autistic children. But then they showed a sudden increase in growth from about 1 to 2 months to about 6 to 14 months. But by adolescence, the brain size of children with autism had normalized. And there appears to be an increased quantity of white matter in the brains of children with autism compared to those without autism. You know very well that during adolescence, the gray matter regrows. But if you have excessive white matter and your brain cannot continue to grow with the gray matter, then obviously your emotional stability and your ability to reason socially will not be supported. There are certain myths and relations, including a lot of parents have believed the story of our colleague, Dr. Wakefield Andrew, who suggested that the MMR vaccine may be a cause of autism. However, his study was actually pulled off the internet and even pulled out of circulation because various studies have shown that actually MMR is not a cause of autism. We know that even way back before the MMR vaccine was developed, in Japan and even in other countries, there were documented children who had autism. And therefore, we do not think that autism is related to the MMR vaccine. There's also a theory that some children will develop improvements if they are given certain diets, including gluten and casein. Unfortunately, this theory has been found to be problematic and not true. And then some children have been tested for opioids in their urine, and they found higher levels of opioids in some children with autism. One problem with this theory, however, is that if you give an opioid blocker to these children, it doesn't change how they are born. And therefore, we now believe more the theory of genetic predisposition. Autism is usually a retrospective diagnosis. That means you have to ask the parent various questions. When did your child start smiling? When did your child start walking? Because developmental history is extremely vital to the diagnosis. The hallmark of diagnosis is inconsistency in development. For example, a child may get regressions or spurts and delays, and there's a greater variation in transition from one stage to the other. So the common referral notes for which we become suspicious are that the child started to say ta-ta-ta or bye, and then they stopped completely. And a lot of parents relate this with, he's the only child. He has no children in the home. And so it's very important for all of us, including all the parents, to understand the developmental milestones. The developmental milestones start at around 6 weeks, when a child is able to smile at you and recognize your face as a parent or somebody who is their friend. They start copying sounds and they begin to sit without support. They like to play with others. They can do peekaboo. They understand saying mama around 6 months or 8 months. They can start to pretend, feeding others. They are able to point at things at around 2 years. They are able to run around and play with other children. By 3 years, every child should be able to carry on a conversation with at least 2 to 3 sentences and be able to climb well up the stairs. By 4 years, a child should be able to hop, stand on one foot. They should be able to play with other children rather than alone. They should be able to tell a story. For children with autism or autism spectrum disorder, they may not be able to do all these developmental things by the time they are 4 years. Some of the oddities that we recognize in children, even those without autism, are spinning, walking on your toes, being picky with food, disliking certain labels. So many children with autism may be developmentally normal. But the important thing for all of us to understand is that they may take these oddities a little too far. There are signs and symptoms related to chronological or mental age. And the first one is many of these children will fail to imitate or initiate baby games. Like I said, peekaboo may be difficult to do. Peekaboo is hiding and playing and or giggling with their parents. These may not be able. And they are not able to communicate their common emotions like hunger or pain. They'll probably just cry. And parents come in when they are extremely frustrated. I once dealt with a parent who had 2 children who have autism, and she was extremely frustrated. And autism is very common. The current CDC estimations, which have not changed, put it at 1 to 100 children. And obviously there is quite a delay in diagnosis because some parents don't know how children develop. Kogan and others reported a prevalence of 1 in 91 children with a gender ratio of 4 to 1, meaning boys are more likely to have autism than girls. A lot of these conditions are not even diagnosed. And that is why in Uganda, we don't have a lot of data, but we do have a clinic, the neuro clinic, that follows up children with autism. And one of my students, Dr. Irene Nabitaka, is doing a study to determine which school do parents take their children to who have autism. And I hope that Irene is on this call so that if questions are asked, she should be able to answer. Some of the coexisting disorders include Fragile X syndrome, epilepsy, and some developmental syndromes, like Turner's, tuberous sclerosis, some metabolic disorders like phenylketonuria. Some children with autism also have attention deficit hyperactivity disorder, or they may have obsessive compulsive disorder. The higher functioning children with autism spectrum disorder may have depression and anxiety, and some even get on to develop psychiatric disorders. We continue to see adolescents who have autism spectrum, and sometimes the parents are just concerned, this child doesn't concentrate in school, this child doesn't do well in class, they call them stubborn, And yet, in fact, when you do a retrospective analysis, you realize that this child is on the autism spectrum disorder. So just to quickly summarize, children with autism spectrum, the younger children may have little or no interest in establishing friendships. The older ones may have some interest in friendship, but lack an understanding of social conventions or how to interact. And often an individual's awareness of others is markedly impaired. They don't know how to be happy, they don't know how to be distressed, and they may appear oblivious to other children, including their own siblings. And when speech develops, there may be a particular intonation or rhythm with either monotone or inappropriate context to speech. There are grammatical structure abnormalities like repeating jingles, or they could have idiosyncratic speech. And sometimes comprehension of speech is delayed with a disturbance in social use of language. And imaginative play is often absent or may be remarkably impaired. Like I said before, in terms of behavior, there may be insistence on sameness, wanting to use the same spoon all the time, wanting to use the same seat all the time. And also there are stereotyped body movements and postural abnormalities. Like a child may want to sit curved all the time. They may be preoccupied with parts of objects or may be fascinated with movement. I've read about a man who has autism spectrum disorder. He's an architect in the United Kingdom, and he's being used by the City of London to be able to memorize images. So they put him in a helicopter, you can read about him, and he will remember image by image of very tall buildings and come back to his office and draw exactly what he saw. People on the autism spectrum may be highly attached to inanimate objects. For example, a child may be fixated on a doll or a particular car, and that is what makes them interested. So how do we assess a child with autism? First of all, we look at their motor skills, we look at their communication, we assess their social skills and emotional assessment. Then we look at their cognitive ability and their academic ability. And we do a quick behavioral assessment and then a family assessment. It's so important to do a family assessment because ultimately the success of a child who has autism includes doing a proper family support system. So the current gold standards of evaluation include doing an autism diagnostic observation system. This is done directly with a child, and we work with a psychiatrist to help us. Then doing an autism diagnostic interview, which is done with a parent. Other tests include doing a Gilliam test, a conversation assessment, doing the Wing, Atwood, Otneys. These are specific for the doctors on this call. So in terms of the medical assessment, the first test we do is hearing assessment, then visual screening, and then doing a speech and language evaluation, as well as doing occupational and physical therapy evaluations. We must do a growth milestone assessment. For example, studying to see if the child has a normal size of head. Some imaging can be done, but let us be cautious with the imaging. We could do a CT scan or an MRI to establish that the child doesn't have other problems like tuberous sclerosis or leukodystrophy. And then doing an electroencephalogram will help us establish if the child has epilepsy or not. And some people have specialized in doing psychoeducational testing. What is the level of intelligence of this child and in which school can they be put? So the American Academy of Neurology has warning signs, and these I will go very slowly on. including if a child is not babbling by 12 months. Babbling means the child goes blah, 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 da, 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 like that. And if a child is not gesturing or pointing or waving goodbye by 12 months, you know, you see a child and you're saying bye and the child doesn't respond. If a child has not had a single word by 16 months, that is 12 months, 1 year and 4 months. If a child has not spoken together simultaneously, 2 words. This is not saying bye-bye, mama, bye-bye repeatedly. No. Correct simultaneous words. Or if there is no previously acquired language or social skills at any time. So the prognosis is going to depend a lot on one, the school age at which this child joins school. There's low functioning autism spectrum disorder, there's mild functioning, and then there's high functioning. And we say that high functioning children on the autism spectrum are the ones who we say have Asperger's syndrome. So Asperger's disorder, or also called high functioning autism, is recognized by researchers as the temporary status of the DSM or ICD definitions. And clinicians have been less reserved about the use of this diagnosis because they wish to secure an appropriate service for our patients. So what is a diagnosis? Obviously, it helps to have a diagnosis so that you do not call it witchcraft, spiritual disaster, God knows what else. It's important to have a diagnosis so that you are able to manage your child properly. The relative strengths include verbal ability. If a child is able to vocalize, can memorize, and then also there are children who have weakness in non-verbal areas. For example, visual motor skills, then the pragmatics of language. It's important to look at the faces of our children. Is the child happy, sad, anxious? And then there are characteristic ways in which people learn. A disproportionate reliance on language as a principle means socially relating to others. Then understanding numbers or grasping, and even understanding the emotional state of children with autism. Children with autism can become, they develop tantrums, they start at 2 years, throwing themselves. I've seen people who may not understand children with autism and they do not appreciate what the parent is going through. There's limited appreciation of humor or irony by these children. And sometimes there's a lot of misinterpretation of other people's behaviors or intentions. So in terms of the nonverbal learning disorders, the major characteristics include bilateral tactile perceptual deficits, poor adaptation to complex situations, repetitive speech, and also some of these children may have well-developed verbal capabilities. The educational evaluation will include an IQ test, an achievement test. Then there are social phobias. Children with autism spectrum disorder versus Asperger's syndrome, both groups are socially awkward and some may be anxious in social situations. I know a high-functioning person with Asperger's syndrome. They are very good at computer development, but if you ask them a question which is outside their normal, what they've been prepared to ask, they may actually throw you out of their meetings. Children with autism spectrum may avoid social situations, but both groups generally want to have social interaction. There's a general fear of being scrutinized by other people, particularly recognizing fear as being unreasonable. So in terms of treatment, and this is my near to last slide, it's important for us to do family and caretaker education, do cognitive and academic interventions, offer speech and occupational therapy, provide social skills, provide applied behavioral analysis, and even treat the comorbid disorders. I mentioned earlier that children with autism spectrum disorder can have anxiety, depression, they may be agitated, or some may be actually aggressive. There may be belligerence, and there are stereotypes that need to be treated. There are alternative treatments, but with no specific data, including the holding therapy. There's also providing secreting of vitamins and dietary regimens. There's the anti-yeast therapy, there's brushing, then the Higashi daily life therapy. But all these alternative treatments have no data. And if people are willing to give us data on these, we would be very happy to share this information. So how should we treat children with autism spectrum? First of all, there's one thing that is constant. Parents are desperate. They will often try anything, including experimental therapy and even unproven medications. And absence of good research data has not affected prescription patterns. It's important for us to assess the child with autism. If they have a comorbidity, treat it, and also do a lot of family counseling. We want every child to grow up and reach their fullest potential. We want every child to go to school and be happy. So in terms of summary, sorry, this was a mistake. We know that every child and adolescent counts. It's very, very important for all of us, even as parents or as clinicians, to support every single child. And an interdisciplinary process is what is recommended. You cannot do it by yourself. A pediatrician needs the support of educationists, needs the support of a psychologist, a psychiatrist, needs the support of a neurologist. And from the time of screening through intervention planning, and the evaluation process needs to be family-centered and culturally sensitive. We have to respect people's cultural views, because if a person's culture means that they simply don't understand the concept of autism, don't push your knowledge on them. Meet them halfway, and at the end of the day, support the child. Like I said, we run a general adolescent clinic. It's general because it sees all kinds of adolescents and adolescent age 10 to 19. In this clinic, we offer services such as immunization, sexual and reproductive health, psychosocial counseling, career guidance, school health management, and life skills training. And sometimes the only reason why a parent is bringing their adolescent to the clinic is because they don't understand each other. And our job is to create mitigation and support for the pair and be able to improve the child's life. I want to acknowledge my parent department that has allowed me to explore in this area, but also to thank you, Christine, and the Autism Care Uganda for putting this webinar together so that we all learn from each other. Thank you very much for listening, and I'll be able to take questions as they arise.
Thank you so much, Dr. Sabrina, for that very educative presentation. I believe we've all picked something. For me personally, I've learned a lot more about autism that I didn't know. I would like to request that we post our questions in the chat room, or you can send them to me directly, or you post them in the chat group. We'll do a few questions, although we would wanted to do a Q&A after the next presenter has spoken. but we can have room for maybe 3 questions, and then we'll keep the rest for after the next presentation. Dr. Sabrina, I hope you'll still be available for us to have a Q&A.
I'll be here, Christine. Thank you so much.
Perfect, perfect. Okay, so let's have room for about 3 questions, and then we can move on to the next presentation. Yes, I see Nango Zikula. I see your hand up. Please, please make them brief, precise, and straight to the point so that we save some time. Someone had their hand up. Okay, let's move on to Nina. Nina, please. Nina, please go ahead and ask your question. You're muted. Just in case you have a question to ask, please unmute yourself and go ahead.
Good morning. Thank you so much, Dr. Sabrina. My question is, if you had a child who perhaps regressed because you didn't talk about the regression so much, then after the child is now picking up again the skills. So how do you diagnose? Okay, how do you term that? Because if the child stopped talking, then now they are talking, they are starting to start talking again. Then if they had certain symptoms and they are disappearing and others are coming, you didn't give us so much light on such a situation. Thank you.
Thank you, Nina. Like I said, it's very important for us to do a retrospective assessment. And regression, as we know, can be caused by various things. First of all, if a child is psychologically affected, you know, mom has gone on a travel, dad is yelling in the house, or mom is extremely stressed, the child can become psychologically affected and regress. But a child who has autism spectrum disorder may be developing normally, started to crawl, and then stops completely, like completely stops crawling. And it takes a period of more than 2 weeks. And you add on other things. And I said, you have to have at least 6 out of the 12 diagnostic criteria for you to say that this child has autism spectrum. The purpose of my presentation was not to create anxiety among the parents, but to increase your awareness of the possibility that your child could have autism spectrum disorder. The verbal inability, the lack of social development are things that are pointers for you to be concerned about. I hope that answers your question, Nina.
Thank you.
I hope you got the information you wanted. I will move on to Clementia, and ask. Clementia is asking, is autism treated by parents to a child?
Sorry, I missed that question.
Yes, Clementia is asking, is autism inherited from a parent to a child? And I think the second question is, how do you help parents of those of children with autism? I think that's something we'll answer later. But to Dr. Sabrina, the question is autism inherited from a parent to a child?
Autism is not inherited. You may find parents who are not autistic, and they will have children with autism. Like I said, the current theories describing the cause of autism are still being studied, including that there are certain genes that have been associated with autism. we also know that the child who has autism may have a big brain, and that brain mostly has white matter. So we don't exactly know why there are increasing numbers of children with autism. And that is why it's so important for all of us to be interested and be able to identify a child with autism much earlier, because their outcomes are better. But also we know that it's a spectrum. Some children have severe autism and others have mild autism. And there's also a spectrum which is called high functioning autism. So unfortunately, it's not good to do the blame game. Some people will say, in your family there's autism, in your family there's autism. So it's important to put the family together, the parents especially, and counsel them and let them look at the child.
Okay, thank you so much, Dr. Sabrina. I hope that Clementia, that answers your question. There is a hand up.
Yes, thank you.
Yes, please go ahead.
Hello, Mwalimu.
Hello?
Hello, I'm asking,
Yes, please.
according to the research that there's somewhere you pointed out that the male children are more affected with autism compared to the female one. Does it mean that the female children, they have hormones that protect them from not getting the disease? I would like more clarification on that one.
Dr. Sabrina,
That's a very,
okay.
Yeah,
Yes,
that's a really good question. I had, why is it boys more commonly affected than girls? And I would spend a long time trying to answer this question. Would need a systematic review to be able to avail a good answer. These are studies that of people who have brought in their kids and followed them up. And we now know that the male to female ratio can be between 1:1 or can even be 4:1. This was just one particular study I quoted. And so don't take it as gospel truth, because we need many more studies, even from our setting, to see if this is actually the truth. Thank you.
Sorry, I was muted. Thank you so much, Dr. Sabrina. Unfortunately, we'll have to move the questions to the next Q&A. That will be after the next presentation, but keep your questions coming. We'll note them down and be able to stage them to the different panelists. Please have the questions coming, but we'll have to move on in the interest of time. We'll have to move on to our next presenter, and that's Dr. Prossy Nakanwagi, who is a parent to a child with autism, and she's going to give us her experience and what the journey has been for her. You're welcome, Dr. Prossy, to this session, and we are looking forward to hearing from you and giving us your experience, as well as encouraging parents of children with autism. So, Dr. Prossy, are you here with us?
Yes, Christine. Good morning, everyone. Thank you, Christine and Autism Care Uganda for organizing this, and for all of you on this call for honoring the invitation. And your being here is actually a sign that you're willing to walk this journey with us. I'll be sharing my story, or our story as a family, and not because I know it all, but because I've learned a thing or two on this journey, but also because I want to encourage and inspire parents to work their best to ensure they improve the livelihoods of their children, but also to say that where there's a will, there's usually a way. Thank you very much. I'll stop my video. So this is my journey and our family journey, raising Matthew Musitwa. Are you able to see my slides?
Not as yet. Doctor, yes. Dr. Prossy, yes, sir.
Are you able to see?
Yes, we can see your slide.
Okay. So I'll start by trying to describe what autism or ASD has meant to me. This has meant different things at different times. Before the diagnosis, there was a lot of apprehension, anxiety, confusion, and wishful thinking. You'd see a bit of telltale sign, but no one wants to believe the worst for their child. So during diagnosis, this was specifically a very frustrating period because it was long, with too many suggestions for different investigations. But I must say that at that time, there was not even a specific place that you could go to have these questions answered or have the diagnosis. So I'll speak more about the investigations. The investigations were costly, stressful, because too many times, me and the dad had to keep away from work to ensure we went through the investigations and visiting the different practitioners. Then came the time after the diagnosis. Surely, as much as you're seeking to get a diagnosis, when it finally dawns on you that your child has autism, there's an initial sense of loss. You feel like the dreams for your child are sort of out of reach for you. Particularly, I'll say that for me, I had a dream that my children, I wanted my children to be independent at a very early age. But with this diagnosis, that was reversed. It wasn't going to come the way I thought it would. So the diagnosis came with a lot of judgment from society, I must say, and too many unsolicited advice. And I think many parents would share this. You'd find people who would be of the opinion that maybe it's a poor parenting style, or the choices that you made during pregnancy or in the early years of your life or your child's life. So I must say that it was a lonely journey for us as a family. But when I and the family embraced the special journey, things began to look up. We committed a lot of resources, not that we had many, but we made it a point that we were going to do the best for Matthew. At some point, some people on this call would remember, we were running around like headless chicken to just seek out therapies. I'll give an example. At some point, he was having therapy sessions from Buganda Road, another from Naguru, another from Mulago, another from Kololo, so many places, and we were both fully employed. But as I speak now, our son Matthew is the most caring, loving, and considerate soul at home. Thus, I cannot trade him for anything. So I want to encourage parents, even as I go on, that don't give up on your child. Because I'll give an example. When anyone is sick in the home, he's usually the person who will stay with you, keep encouraging you on. He likes saying, I love you. He's not here at the moment. Otherwise, maybe you'd hear him telling me how much he loves me. So don't give up on your child. I still have many wishes, and continuously pray for wisdom to guide us on the next steps of the journey, because I must say that we are not yet there, although we have come a long way. So what has it been from diagnosis to now? First of all, I would go back a little bit, but during pregnancy, it was all normal, uneventful. I was surrounded with lots of love and support, both from my husband, friends, and family. So truthfully, I was not sad. There are theories actually that suggest that autism may be because the mother was sad and unhappy or depressed during pregnancy. But for me, this was not the case. However, what I can recall from the pregnancy, that the baby would move too much when there was very loud music. Like, we were young parents, so we used to go to parties, okay? So while at parties, the baby, that time in utero, would move so much. So we used to actually say that, onanaba mudongo. I hope most of you can relate to that, that this one is going to be a musician or a dancer or something, yeah? So I delivered him by cesarean section, full term, and he was very normal. There was nothing to show that we were going to run into a challenge or a problem. So that is Matthew at about 5 to 6 months. I must say that the first 6 months were generally uneventful. He was a happy child, almost perfect, at least in our faces, or in our minds at that time. He was not a fussy baby. He played very well with his toys, and we had a perfect nanny at that time who used to sing and really, like, be there for the baby. He did not cry much. Like I said, he wasn't fussy. Later on, I've learned that actually perfect babies, for me, actually, when I see a perfect baby, that baby who does not disturb, I worry. Not that they should disturb, but there should be some degree of wanting your attention. But he wasn't that type. Once breastfed, he would be comfortable sitting, playing with his toys, and you'd find him where you left him most times. However, at about 7 months, the father noticed that the baby was not looking straight in his eye. That was at 7 months, something which both of us ignored, and we didn't talk about it. But from hindsight, this baby had sleep challenges. He used to sleep for about 2 hours or less. So he was, he was up doing something, crawling, he was active, I must say. And at that point, he had no sense of fear. At some point, we shared with some young parents like us that Matthew was not sleeping through the night. So we're encouraged to sleep at night, breastfeed him, switch off the light, and let him be. To our surprise, one day he actually crawled out of his bed and then crawled to the sitting room. We just had a bang. He had hit his head on a wall in darkness. So at about 10, 11 months, that's when I started to get worried. But as you can realize, that's a bit early. And the reason why I was getting worried is previously, a dear friend of mine, I think she may be on this call, our babies were 3 weeks, they were born 3 weeks apart. So usually they attained their milestones 3 weeks apart. But this time, for purposes of confidentiality, I'll not mention the name of the baby girl because she's now an adolescent, okay? So the baby girl started saying a word at about 9 or 10 months. And normally, when they would attain a milestone, they would call us. So when she called, I said, we've not had a word from Matthew. So that went on 11 months, there was no word. So as you can realize, all this time, Matthew was attaining his milestones pretty fast. So at 14 months, there was still no word. Although I said speech, we don't expect a lot of speech, but at least, you know, like single words, mama, tata, dada, stuff like that. But that was not forthcoming. And yet the other baby girl, who would be compared, who we're comparing with, had actually now progressed quite a bit. But also at that point, he was spinning a lot and had subtle blank stares. You'd catch him just staring in space, you know, something like he's deep in thought. Yeah, the spinning, yes, children spin and babies spin, but children with autism tend not to have that sense of dizziness whatsoever. So he would go on and on for a long time. So that became a concern. At 18 months, when our second child was born, all symptoms became very pronounced. Matthew at that time was isolating himself. He was no longer the smiley, happy baby. The blank stares predominated most of his day. He had anger outbursts, which at some point we thought, oh, maybe he had sibling rivalry, but I mean, it was too much. He was just too angry, okay? Then the spinning intensified that if you left him, he could do even 30 minutes without ever feeling dizzy or falling. I mean, I'd seen children before, but this was very queer. And in addition, he used to wander away from us. For example, you're at a party, before you know it, he's run away from you. I remember a particular time we were attending a wedding of a dear friend. And then while me and the father are seated, somehow he wanders away from us. And the next we see him at the high table. What is he doing? He's drinking the bridal team's soda. So you can imagine the embarrassment. So he also had indiscriminate eating. Anything that was near or found itself in his mouth, he would eat. One of the worst that experiences, one day we caught him with a caterpillar in his mouth, you know. Then he also was so hyperactive. He wouldn't settle down. And in addition to that, he was fidgeting a lot with his fingers, something that would later on learn that it was stimming to self-stimulate. So basically, I would say that at that point, he just changed. This was not the child I had in the months before. He just went into a shell, you know. He was not interested in his surroundings. He was not interested in us. He was just in his own world, so to speak. While all this is happening, deep down, I knew something was wrong. But at the same time, I did not want to believe. You don't want to believe, but also there's a lot of reassurance from the older people. They kept on telling us that they knew a member of the family who had spoken late, so we didn't have to worry. Then, you know, I mentioned he was fidgeting with his fingers. So still we're told that usually that's a sign of wisdom, that this child has to double check everything. Like if you gave him an apple, he would look at it, you know, keenly before ever eating it. Anything he touched, he had to, you know, look very keenly at the item. So the consultations with doctor friends at that time did not help, because they also thought my expectations were just too high. And I was reminded that all children are different and tend to attain their milestones at different points. And yeah, so it was a lot of confusion. So at some point I put off the informal consultations. I continued to nurse my suspicions, but at 2.5 years, at the recommendation of a visitor in our home, we took him to Marigold Kindergarten. Marigold, I don't know whether it's still there, but it's it was around Kiwatule Recreation Center, and Ndere Troops, to be exact. Okay, so they had it was a normal kindergarten setting, but they had a bit of an occupational therapist who used to visit once in a while. So that's where the diagnosis, that's where we first heard that Matthew had autism spectrum disorder. As you can imagine, the doctor and me decided to seek for a second opinion. You can imagine you've been thinking, suspecting that the child has an issue, but when you are told, finally, you still want another opinion. So there we were. We went to a senior pediatrician, but also this person had been my teacher while at medical school. So when he did the assessment at that point, he did not believe that it was ASD because it was not really fitting in, you know. So an array of investigations were requested, in particular EEG to rule out epilepsy, audiometry, but to name a few. But there's a lot of frustration, and I hope this has improved over the time, because normally you want to do an EEG on someone who is still and calm, but with a hyperactive child, this was not forthcoming. And at some point they decided to give him a sedative. But the audiometry, I don't know if they are still requesting for the conventional audiometry, because for a child who is not able to cooperate, a child who does not follow instructions, this is very frustrating. So in our case, we're not able to do the audiometry because he can't concentrate. First of all, you need to be still, listen to those sounds. How do they listen to them when they don't even know what is happening? So as you can imagine, we were not able to do the audiometry. So we go back to the pediatrician. At that point, he referred us to Nairobi to do a brainstem audiometry. That is when I woke up from my sleep, if it was a sleep anyway. I remembered a psychiatry class that I'd attended years before in my 4th year of medical school. I could remember that my son's symptoms actually met the criteria for autism. So these are a few pictures where in this particular one, you see that Matthew is being restrained. You had to hold him. He was running somewhere, and I don't know. He was always on the run. So the second picture, we're actually attending a party, but look at how dressed we are and how smart we are. He's eaten, he's actually sitting down, you know, and he's just in his own world. So usually this is one of the classical symptoms, by the way, really a telltale symptom. They block off noises. But later on, I learned that it's not just noises. Sometimes it's a way for them to tell you no, they're not interested in something, or the noise is too much, you know. So I think for the parents, many of you have seen that in your child. Although now when he began to speak, when I asked him why he was holding his ears, he told me his ears actually hurt. So It goes on to say that they're not pretending, it's a real problem. They actually feel like there's pain in their ears. So at that point when I woke up, I made up my mind to embrace the journey. I knew that it would not be easy, but my personality, I'm kind of a very resilient person, and normally I want to work with what I have and also to be part of the solution. So that's where the journey starts. Although the father had his reservations, he always believed that his son was okay, his son would be okay. He was extremely supportive of whatever idea and intervention I proposed. I must say that he's a very strong man because I proposed too many things at some point. This is a journey of great faith, hard work, lots of learning, lots of trial and error, lots of imagination, but also believing the very best for this child given their circumstances. So far, we've committed lots of family resources, but unfortunately, when you're treating an invisible, because autism is an invisible condition, you don't, there are conditions where you clearly see someone has a problem, but for autism, if they don't have another comorbidity, they are very normal. So someone would wonder why you're taking them to therapy, why you're doing the things that you do. But if you're a parent, do it anyway. So we've attended, or Matthew has attended many schools, some for a month, others for as short as a week. We've bought so many uniforms from so many schools, yeah? So it's been a journey. I usually say that we're not where we want him to be, but I'm extremely grateful to God for the far we have come. Extremely grateful, because in as much as it's 13 years, I would say that this is like a lifetime. He's now 13 years, moderately verbal, can form friendships. Academically, he's far behind his peers, although he knows many concepts than one can imagine. And I usually want to say that if he can no longer be classified as illiterate. So that gives me a lot of joy and pride, even where he is now. At the moment, we are exploring possibilities for the future because he's losing interest in the academic activities. Like, for example, I'll give you a story that at school, his main highlights actually are food. When he comes back home and you ask him, Matthew, how was the day? He will tell you, the food was yummy. I had chips and sausages. You can imagine I'm paying school fees, or we are paying school fees to get such a report. So clearly we have to look outside the box. We already are thinking of activities like he's doing piano lessons. He seems to be kind of interested in piano. We are thinking of many other things that we can share at a different fora. So what have we tried as a family? Given that the exact cause of autism spectrum disorder remains unknown, the treatment is unknown too. So there are many therapies and management treatment modalities that exist, but these are usually aimed to improve their cognition, that is their understanding, their speech, or reduce the abnormal behavior, but also improve their everyday skills. Different interventions, I must say, yield different results. However, this I emphasize, with consistency, love, and dedication, these children can learn something. You know, an autistic brain, although I know many people don't want that term. Sorry that I'm using it, but I want to say that an autistic brain can learn. So I usually want to ask people that, for example, if you came across someone who speaks Lingala, I don't know if there's anyone on this call who speaks Lingala. Would you understand them? You wouldn't understand them because you don't know it. So it's basically finding a way to teach them because they can learn. However severe it is, they can learn something. It is important to research, consult, and exercise caution before deciding to start a therapy. So I want to talk about a few things. They're actually not few. What I've called fundamental, no, not fundamental, but they are fundamental foundation concepts. For parents on this call, and for those that will be talking to parents, the first place is that as a caregiver, parent, in this case, you need to heal. It is difficult, a diagnosis, but you have to heal, purpose to heal. Yes, you'll go through the cycles, just like it's just like when you receive any bad news, no one accepts it the first time, but allow yourself to heal. Because when you heal, you will be able to support this child. You cannot support this child when you're still crying. Parents call me and they are crying, you know. In the initial stages, it is okay, you could cry, but you cannot cry all your life if you're going to stand in the gap. You will need to protect your heart from negativity. There are people who will actually say things, you know, because personally, and us as a family, we've had this. So I know that there are people who will say things like, maybe as a mother, you didn't do your job. It is not because you didn't do your job. Or you're too busy, you're corporate, so you're not giving your time, enough time to your child. Not all children born to busy parents actually come down with autism. So protect your heart. You'll need to have a lot of love, patience, and calmness. These children, while you may think they don't understand, they actually do. They observe you. If you're communicating doom, if you're communicating lack of hope, a lot of despair, you're crying around them, that they will pick. And unfortunately, they may become. Sometimes our children just give us what they think we want or what they think we believe they are. So a lot of patience will help you. You don't have to go yelling all the time, okay? So be calm. These children need a lot of reassurance. In our case, if you tell Matthew, good job, or you are a good boy, you're doing it right, you are a star, these really, really encourage him, and he tries his best to up his game. I encourage us to embrace lifelong learning. You will not know everything at a go, and don't expect your child to learn all the things at the same time. Even typically developing children take time to learn several things. So for these children, you'll have to slow down a little bit. But like I said, if you're consistent, if you show love, they can learn. Teach them, say and do the right thing. If you know they are supposed to say thank you, say it anyway. Whether they repeat or not, that is not your problem. If you know you're supposed to tell them, good boy, go ahead, say it. You know, you never know when they will actually say it. Just like typically developing children, they store so much, or they acquire a lot of words before they actually speak them. So be encouraged that to continue saying the right thing and doing the right thing around them. Expose them to different environments. Don't just leave them at home. You know, some people are tempted to just leave them at home. It is difficult to move around with them, especially when they are younger, hyperactive, and a lot of abnormal behavior, but this is your child. Embrace the child. Expose them to different environments. I remember when he was younger, we used to take him to many many kids' play spaces. There are many around Kampala, many around all, you know, different places. We took him to the zoo. We took him to take them to the supermarket, take them to schools, take them to church. Basically, everywhere that you would have taken your other children. This is still your child. So by leaving them at home, you're saying something else, that maybe this is, I don't know, whose child. I also want to say that focus on their joy and happiness as well, and not just speech. Most of us parents usually focus too much on the speech or what they cannot do, and forget that at any one particular time they can do something. Focus on their joy, make them happy, purpose to make them happy, you know. I'll give an example that sometimes, what was I saying? That purpose to make them happy. It doesn't matter whether they actually reciprocate, but do your best, yeah? Usually they are in a shell. Try to go into their world. Don't expect them, you know, when like they're isolating and steaming and doing all sorts of things that are irrational. Go into their world, join in, you know. It's just like, I don't know many of us who fell in love with our partners the first time they approached us. They approached you many times, they told you many nice things, and with time you believed them and went on their side. So this is how usually I want to relate it. They are in their world. Can you reach out to them? Can you go to them? Can you extend love? Can you extend compassion, patience? Show them that they are the best, even when you know that there are all these limitations. Celebrate them rather than punish them. What do I mean? That as much as possible, concentrate on the good. Concentrate on what they can do. You know, concentrate on bringing out the best. Yes, there are vices. If it is not too major, you can even ignore. I'm not saying you don't punish them, because this is at different stages. Like now, Matthew knows that if I'm very upset, I will tell him to kneel down. And for us now, that is his worst punishment, asking him to kneel down, or you don't allow them to use a gadget. But especially when they are younger, celebrate them. Let them continue hearing their name. By the way, they like hearing their names, you know. Whatever you do, and say, let their name be heard. You know, Matthew, clap your hands. Matthew, do this and the other, you know. Create a conducive environment wherever they are, at home and at school. At home, engage everybody. As a parent, as a mother, as a father, you'll not manage to do it all by yourself. You'll break down because it's a lot of work. It takes a toll on you. So engage whoever is at home, educate them. If there are these home administrators or other relatives that live with you, educate them. There are now videos on YouTube. There's a lot of information, you know, that you can collect and study it as a family. Make this, you know, as much as possible. Create a conducive environment for him. consistency is important. I know that many of them like rigidity, although in our case, he doesn't like a lot of structure. He doesn't like a lot of scheduled life, yeah? But for most of them, they actually appreciate that, okay? Then simplify things for them. It is already difficult. Simplify things for them. In our case, at the advice of one of the special needs teachers that time, we were encouraged to choose a language to speak to him. And it's not because personally I'd wanted to, for my children to be very, very fluent in Luganda, our mother tongue. But we had to make a difficult decision that we were to speak English to him. Reason, not because we wanted to be modern, but because we wanted to simplify it for him. So imagine someone who is already challenged learning one word. So if you're introducing 3 languages, it becomes even harder for them to do what? To actually cope with all that. It is simple for a regularly developing child to acquire even 3 or more languages, but for them it's much harder. So if you're able, stick to 1 language, or 2 at most. I talk to parents who speak 3 languages. Surely, personally, I've been living in Nairobi for 4 years, and my command of Swahili is not that good. So if it is difficult for me, it would be difficult for the special needs children, or for autism in particular. Although I know there are those that are good. So, like I said, it is not a one size fits all, but where you can simplify things. So I will go briefly through the specific interventions we have tried. Some with a lot of success, others, like you heard, there's a lot of disparity on this journey. So occupational therapy, this is like a standard. And basically occupational therapy is aimed at improving everyday life skills. It works on the cognitive or understanding, the physical and social skills, okay? So there are occupational therapists everywhere. But if you are an occupational therapist or a therapist on this session, as parents, I'm speaking on behalf of parents, please, your costs are too high. If you can, kindly consider thinking about the parents, because this journey is not a short one. So there's also speech therapy. Speech therapy is basically aimed to improve or to handle issues or disorders of speech and language, okay? So speech speech therapy is offered in Mulago Hospital, but because there are so many other conditions that compete for this, it's not so easy to get on the list, but you can actually get it. Occupation therapy too, okay? Then we've also tried massage therapy, and this basically, you can read about it, but in our different communities, I think massage is, you know, it's part of it. But for me in particular, we used essential oils. Essential oils, like lavender, we've used lavender a lot, yeah. So basically massage therapy helps to calm them down, you know. So if I wanted to teach him something, especially when he was younger, would start with a massage, okay? When we add therapy, it becomes very exotic, but it's basically a massage. What do I say? Okay, massage. I want to imagine that everyone understands what that is, okay? Then we've also done sensory stimulation. So sensory stimulation, you look at all the senses that we have and try to ensure that you're improving them. So for the site, you want a bright colors, but some, you have to take note that some can be very sensitive to bright colors. So you work with a child that you have, okay? So sometimes even just having balloons, pictures on the wall helps, because they are seeing things that are stimulating their brain. The sense of smell, we used to get those essential oils, a bit of perfumes, and you make them smell them. Like, you can imagine, as a mother, I have total anosmia, but I had to buy lots of that, you know, to just let him experience that, okay? Then for the sense of touch, there's brushing. You can use different textures, actually. Cotton wool, you use soft, you use hard, different things basically. So it's about stimulating their senses. There's a study actually that I read about where they compared children who had undergone sensory stimulation for 6 months, and it actually helped. And they were doing, the sessions were about 30 minutes. You know, you just choose to stimulate this sense and the other, okay? Then we've engaged in sporting activities, tennis, cycling. Tennis and cycling, these improve their coordination, okay? Their sense of judgment. I don't know how many people have played tennis, but for me, when I went on the court, I was missing all the balls. When I managed to get the ball, then I wasn't putting the hands and my legs where they needed to be. So it actually helps. Although he doesn't like the running, we know he can never do the competitive tennis, but he has an idea. He's actually better than me. So we've also done swimming, and in the swimming, when it's used as a therapy or water play, they are in the pool, you put their different objects, and while you are at it, playing in the water, you're showing them objects, you know. It is thought to also improve coordination. Basically, it improves their sense, you know, their confidence. However, I must say, as they grow older, they can take charge. Like we had gotten a very good swimming instructor, only for Matthew to tell me that swimming is very dangerous. You can die in the pool. And I respected him. So he's no longer swimming because he told me he can die in the pool. So we've also done karate. Karate, you know, karate, kung fu. He's done puzzles until he told us puzzles are for old grandma, whatever that meant. So in addition to all that, we've done dietary measures before. Although there's conflicting data regarding dietary restrictions and all, but I must say that for us, we did it for about 2.5 years. We from his diet and from the family diet, we removed wheat, we removed sugar. At that time, we removed milk and processed drinks, especially the sodas and those, what are they called? Fizzy drinks. We quickly noted that when he did not do sugar and the soda, he was not as hyperactive. So surely, in as much as there is conflicting data, if your child is hyperactive, you want to go low on the soda, on the ice cream, you know. But for me, I would say that when you first remove these, the milk, the wheat, you just want to find out what could be the offender. Like at some point for us, we noticed that wheat, when he ate wheat-based products, that's when he would do a lot of fidgeting with his fidgeting and flickering with his fingers. So when you reduce that, then you see a reduction in that particular symptom. Then we've done play therapy. This we still do, although now not at a rate that we did when he was younger. When he was younger, I actually formed a play group around my home. Many people actually in that place thought I was a nursery school teacher, because I would rush back from work, just gather children from the neighborhood, and we play. That kind of improved his social interactions, although after a long time, you know, you're singing, you're dancing, you're playing like a child. Basically, you want to meet them at their level. You will not just talk, you know. So it's basically meeting the child at their level. So we also did special needs education. By that time, there was a lady, I think she still does sessions, an Indian lady. She was good with the younger children, you know. So that kind of helped a bit too. Then music therapy. Music is used as a therapy to help with their concentration, their coordination, but also some instruments like the keyboard and piano are thought to improve their mental coordination, so to speak. We've used pets and inanimate objects like teddy bears and dolls. Some of you have shared this story with you. There's a time that we had this particular teddy bear, and we called her Bear. So Matthew that time is not speaking to any of us, but we decided to speak to the teddy bear. You know, the teddy bear was like one of us. So we would say, Bear, clap your hands. Then one person is holding the teddy bear and trying to clap their hands. Bear, drink water. Bear, walk. Bear, do this and the other. After about, I don't remember that time, but after some months, one day Matthew goes, Bear, drink water. You know, so from then we saw an improvement, you know, with his use of words. Then we've also used pets. Particularly what he loved were rabbits. I noticed that when the rabbit, we used to do an hour of the rabbit, yeah? We give him the rabbit. You're not really supervising him, you're supervising him from afar. We noticed that he would speak more with the rabbit. Eat grass, you know, words that he was not speaking with us, yeah? Eat grass, sleep, you know. So use of pets can actually be a game changer. Others love horses, you know, others love different things. So basically, it's about introducing different things to these people. This should be like one of my last slides. Other things that we have tried, homeopathy. I don't know if you've heard about it. It's an Indian-based treatment. I didn't really understand what was happening, but anyway, it was offered by that time. And I think the Sudhir Rupereria group to give back to Uganda. Incidentally, I found a Ugandan doctor, a Ugandan who had studied in India and was practicing that. I did not understand the principle. They give you capsules based on the history that you provide. We did not see much change with that, so that we didn't do for a long time. Then we've also done acupuncture. Acupuncture is a Chinese-based therapy. You give the history, then they use pins and needles. It's kind of traumatic for both the parent and the child, but we saw some improvement with that. Concentration and a bit of, you know, the child being present. Okay, we've done micronutrient and vitamin supplementation, many of them, but I'll mention a few. Omega-3, for all the parents, omega-3 is good for brain development. So that one you don't have to research. You can start if you're not using it already. We've used lecithin, the methyl vitamin B12. Methyl vitamin B12 actually seems to help. He becomes calmer, and his concentration improves. We've used vitamin E, D. The goodness, some of these vitamins, they're already, vitamins, you can't go wrong. Only that you have to, go to someone who can prescribe for you. Then vitamin B6 in combination with magnesium has also been thought to help with calming them down, but also some people say it helps with speech. We've used Indian herbs like mentat, and I know many people who use that. And now even doctors are beginning to prescribe it. We've used camel milk. Camel milk is thought to have anti-inflammatory properties. So autism, first of all, like we said, we all don't know the cause. There are many risk factors. There are many studies to suggest this and the other. There are those that believe that it's that there's a lot of inflammation, So because camel milk has anti-inflammatory properties, it's thought to help. So let me tell you the story. I started camel milk. I was getting it from a shop here in Nairobi, and we took for some time, for maybe 2 weeks. But remember, this milk is not pasteurized. Yeah, in some places, I know in the US, some places in the US, they have ways to vaccinate the camels and to treat the camels of all possible diseases. So they don't have to do it to get scared of the milk. But in Africa, I don't know if they're doing any screening. So I did it for 2 weeks. By the way, we had started seeing some effects. However, a friend of mine, a dear friend of mine here, reminded me that I was a doctor who is giving unpasteurized milk to their son. So I feared. But if anyone knows a camel or a camel farmer who vaccinates and does everything there is, it's something worthwhile trying. And yeah. So we've also done hemp and CBD oils. There's a lot of controversy about that. But for us, CBD oil, we saw improvement in his sleep, but also calmness and a sense of general, like he understands better, Okay. So we've done herbal and complementary medicine. These would be no-brainer because they are plants. Lemon balm, valerian root, then there are those mushrooms. There are mushrooms that are thought to help. The mushrooms, I did see a lot of change, but valerian root, if they have challenges with sleep and hyperactivity, if you combine it with lemon balm, it seems to help. Okay. So we've also, I've also used repurposed drugs like memantine, and doctors are beginning to prescribe it actually. But for me, when we used memantine, that's when Matthew woke up. That's when he got out of his shell. But that's a story of another day. So what do I advise parents or caregivers? First of all, choose to show up for your child. Okay? If you don't, who are you expecting to do that for them or for you? Autism is not because of what you did or did not do. It is, like they said, it's a neurodevelopmental disorder. You know, disorders, diseases happen, okay? It's not because you didn't do something to God, or you didn't do anything wrong, or you didn't do anything right. Yeah, it's just a disorder. Accept the diagnosis, just like there are other diagnoses. When you have hypertension, you don't start saying, oh, God has cursed me. You start the medication. So can we look at it as a diagnosis, the way you look at hypertension or diabetes? Can we begin to look at it that way? But I must say, guard your heart. You will need to guard your heart. You can't go around crying all the time. Find the strength within you. Find the strength. Or find people you can walk this journey with. Stop the self-stigma. Become your child's advocate. If you don't speak for them, personally, I believe that I am his voice. I have been and I continue to be Matthew's voice. You know, you will not go telling him anything when I am there. Because one of the things I want to imagine, if I had a challenge, what would I want Matthew to do? You know, to bring me down or to encourage me and do his best. Embrace the child that you have, not the one you hoped for or dreamed of. This is your child, okay? Personally, I said that we prayed for a child. God gave us Matthew. So I am going to do my best, okay? If someone judges me, I'm looking at it like, you know what? I've actually told a few people, you can tell God, you can ask God. It is not my problem, and it is not Matthew's problem. So because it is neither my problem, not his dad's, not anyone's problem, I just have to embrace this child. Still, to the parents, take on the child, take on the challenge to love, nurture, and connect with your child. If you connect with them, especially when they're younger, when they grow older, you'll understand them a little more. Today, there are things Matthew knows that if mom changes her voice, she's upset because he knows me. We've connected. Yeah. If you don't connect with your child, you're leaving them to chance. You're pushing them away. When they become adolescents, by the way, they become very energetic. Today, Matthew is taller than me and weighs more than me. So, and has more energy than me. So if he wants to push me, he can push me, but he only stops because we've connected. Okay. Kindly and kindly, don't lock them up or leave them to loiter the compounds. And here I want to say, if you today, God forbid, you came down with a debilitating condition that affected your understanding, you got dementia or any other condition that sort of incapacitates you, what would you want your child to do for you? Would you want them to lock you up in a bedroom, leave you to loiter the compounds or the village, or you'd want your child to take care of you? So whatever you wish for yourself, if you are in that circumstance, is what you should do for them. And here I remember we made a decision that whenever we went somewhere, we went with Matthew. So if you invited us for a party and we're like, oh, should we come with Matthew? And he said, maybe you don't, maybe, you know, I would tell, my husband is Mark, I didn't mention his name. I would tell Mark, we can't go there, because that means that if I got a problem, they wouldn't invite me to their home. That's how I looked at it. So for parents, don't hide your children, okay? Take them where you can. You know, by showing them to the world, they will accept them. Yes, at first there may be a lot of resistance, but they will accept them. I remember someone once told me, maybe when you're coming to parties, you should leave them at home. Then I asked the person that, actually, I didn't ask them, I just told them that since he was our child and I did not know when he would improve, I would actually go with him. So purpose, to show your world, to show he's your world actually, okay? These children become our world and become our center. I think most parents would agree with me. And I want to say that they understand more than you can imagine. They do understand. So there are people who maybe like here where we live, someone used to be, like when Matthew would be the only one outside, would be like mean to him and all. Yet when we are with them, when we are with Matthew, then he would pretend that he's very friendly, you know. One day Matthew just said, "Patrick, you're a very bad man." Even himself, he could not believe. And from that day, he changed. But we have to wait for people to speak up that you're bad, to treat them right. So whether they are verbal or non-verbal, make assumptions that they understand everything, because they do. You know, they understand when you look at them with bad eyes. They understand when you mistreat them. They understand when you are unfair. So now imagine when you're locking them up and taking their siblings to schools and taking them to enjoy life while they are locked up. What is going through their heads? Yeah. Imagine today, lockdown has actually given us an experience. All of a sudden, you can't go anywhere, you can't do anything. So they are locked up. When you're in lockdown, don't you have rights? You still have rights. You have feelings. So they do the same. So kindly respect them. You know, part of showing up, you have to show respect to them, even at their level. Okay. For example, where I show respect to Matthew, when we are going somewhere, I explain to him, like, Matthew, we are going to the supermarket. We are going to buy 2 things. I don't run around, you know, so that he knows what to expect. Kindly, if you have a child on the spectrum or any other special needs for that matter, read and understand about the condition. It will help, because not even the doctors can tell you that they know it all. Maybe it's like another COVID. Not everyone knows it all. So, and not everyone knows what is best for your child. So you're an equal partner in this. If not, you're even, you know, like the highest partner in this journey. So there are parents that I talk to and they're like, oh, I will get a therapist. Getting a one-off therapist will not help. You have to be involved on this journey, okay? Transfer those skills that you've learned out of therapy sessions to home. Actually, the recommended number of engagement is, I think, about 40 hours per week. Who can pay for 40 hours? Very few. I know there are people who can, but most of us can't. So can you transfer some of those skills? Can you take, if you have a maid that is a bit polished, can they go in those sessions, learn these things and transfer them at home? Early on, we decided, and we knew that given the doctor's salary and my husband's salary, we couldn't afford all the sessions. So we decided that we will learn a few things and basically transfer those skills to the home setting. So we learned, for example, in speech, the way they said they do their things, a lot of play, constructive play, you know, but also short, simple sentences. So when we get someone, a home administrator, as I like to call them, we teach them the way to address Matthew. Even the siblings know how to address him. Like, Matthew, come. Matthew, sit down. Now it has improved. He can take more than that, but initially, just 2 words, for example, you know, Jaden, sit down. Don't say, Jaden, you went, you heard. That would be too confusing, you know. Say what you want and say what you mean and mean what you say. By the way, as you speak, they are looking at your face. They are getting those non-verbal gestures. So if you want to mean something, you know, you should mean it in your head, in the way you speak it, and even your face should say the same. Before you embark on a particular therapy or treatment modality, research and consult with parents in a similar situation, or with a trusted therapist or caregiver. Don't spend all your money at once. Think sustainability. There are therapists that come, and maybe you're expected to spend $1 million in a session. Is that sustainable? If it is sustainable to you, that's okay. But many times, you may not be able to change the ball game in a day or two. So plan yourself. When we're, like I mentioned earlier, that we were running around like headless chicken, we were actually spending more than we were earning on just one child. When we had one child, but we were spending like he was at university, we were already spending millions when he was 2.5 years. So you know where our money has gone. So yeah, he's our apartment, so to speak. Be aware of quacks and don't get conned. Be aware, consult. There was someone in Uganda, but also even here in Nairobi, where parents were actually going there quietly. He kept on telling them, no, you know, if you tell other people, they will discourage you. If you have a good service, why can't we discuss it? Why should it be too confidential? Where possible, parents join parent support groups. Okay, find a parent that you can talk to, because sometimes it is difficult. We have different personalities, potential coping mechanisms. You know, for me, it took me between the time the diagnosis was made and the time to really get active was maybe a year. For some people, it's longer, you know, but find the strength. And this strength you can find in the parent support groups. For those of you that are already on these groups, you know that sometimes we celebrate little things. In those spaces, you will not be judged if you, for example, say that my child was able to use a potty for the first time and they are 5 years. Yet in another space, if you said that, they'll be like, oh, you're not doing it right, okay? And lastly, I would like to say that you can rest from time to time to recharge, to take care of your needs, to just feel, okay? But don't give up. Don't give up on your child. If you know you'd have wanted them not to give up on you, don't give up on them. However, if you'd want your children to give up on you, maybe you could consider doing that. Those are a few references. And by all of you being here, first of all, we appreciate you, the parents, their doctors on this call, their friends to families. Each of you in your different spaces, kindly create awareness of autism, because I know that with more awareness, there's more understanding, there will be more acceptance, there will be more inclusion. For the 4 years I've been in Nairobi, I've benefited from the awareness drives that have been done, that especially the first or second year, Matthew still had his issues when we were, let's say, at a supermarket, but you'd never see the eyes, you know, that bad eye, you know, or someone coming up to you and blaming you. It's because the parents in Kenya, especially in Nairobi, have taken it upon themselves to raise awareness, to get ambassadors. So here it's actually, in Nairobi, it's the First Lady, Margaret Kenyatta, who is the ambassador for autism. How I wish we would get people like that in our country to walk this journey with them, because people listen to them, okay? We need more awareness, we need more understanding of this. That is Matthew. As I said, he's taller than me, he's bigger than me, but you can see he can, I mean, by looking at him, you'd never know that he had a challenge. You'd just see a mommy with a big boy. I thank you very much.
Wow, wow, thank you so much, Prossy. With so many people in the chat room that are commending you for sharing your experience with us. I'm sure you've inspired many. You've inspired parents, you've inspired parents to be, and to just be open to us and share with us your journey is really inspiring. I don't know if there's, I feel like she's really said, you know, she's share, you know, when you share a story, there's someone else who can relate. You know, you just never know someone who's going through the same experience and just needed someone who would tell them it's okay, you know, things will be well. So thank you so much. I just love how that one thing that stood out for me, you know, focus, we need to stop focusing on what's missing, but focus on also making them happy. You know, you're focusing on their lack of speech, their lack of, you know, failing to, you know, do certain things, but we fail to focus on, you know, trying to make them happy as human beings as well. Thank you so much for that. So we will open up the floor we'll open up the floor for some questions. There was a number of questions in the group, but because there's been so many messages, I don't know if we'll be able to finish all of them, but what we will do, we'll give 5 questions to Dr. Sabrina, and then 5 questions to Dr. Prossy. So what I can propose, because I cannot go back to the messages, there's quite a number of them, I would suggest whoever chat room, please, I request that we speak up and give that question again. Otherwise, I don't want to scroll through and questions. So I see Grace Naiga, your hand is up. Please, brief, precise, straight to the point, so that we save time. We're already past time to spend on this call.
Thank you, Christine, and thank you, our dear doctors, for the wonderful advice. Mine is simple to any of the doctors. How best do you advise me to deal with a double diagnosis where I have a child that has mosaic Down syndrome, but also presents with elements of autism? Thank you.
Christina, are we taking the questions and then responding, or respond to the questions one as they come?
I think we'll respond to one as they come. I don't know, what would you be comfortable?
Maybe take 3 questions and then respond.
Okay, no problem. So if you have a question for Dr. Sabrina, a second question, please. Sandra, I know you want to ask a question. Please go ahead. Sandra Immaculate, please unmute yourself and.
Thank you, Christine. can you hear me?
Yes, we can.
Okay, I wanted to ask Dr. Sabrina two things. One, I was wondering if at her clinic they do diagnose autism for the younger children. Like, do they do the screening, the autism screening and diagnose? And also, do they have any early intervention work, or do they strictly work with adolescents? And then secondly, I wanted to ask her if there's any relation between, sorry, baby, if there's any relation between autism and multiples, like twins, are they at a higher risk to be autistic, or if a child is a twin and they have some of those symptoms she showed, the milestone thing she showed, if some milestones are being delayed, and like you go to a pediatrician or someone and they're like, oh, it's a twin, they tend to do that. Should you still be worried about autism, or yeah, like something like that? Is there a relation there, or is it normal for them to be delayed in many aspects and you just wait? Thank you.
Thank you, Sandra. And Annette had her hand up. Nangobi, did you ask your question?
Hello?
Already?
I did ask.
Yes.
The other time I said, because I was trying to unmute and I was failing.
Okay. I still see your hand up. We'll go to Nina. There you go.
May I ask?
Yes, thank you,
Oh,
Doctor. Thank you, Christine, sorry, and the doctors that have presented. Caesarean sections and autism. There have been so many, sir, I'm so sorry. There are so many theories about C-section and children becoming autistic. So is it the C-section that leads to the autism, especially, of course, if you had two scissors, most likely the third one is going to be elective. So really, I want to find out about the C-section and autism. Thank you. I'm sorry about the background noise.
Okay, it's okay. So I think we'll have Dr. Sabrina respond to those three questions. We'll give her room to respond to not all the questions, but a number of questions at once, and then we can move on to Dr. Prossy to also respond to questions. So we'll have room for 3 more questions after she's responded to these questions. Thank you.
Okay, thank you so much for those questions. It shows that you are listening. To Grace, it's a challenge if a child has a double diagnosis. Obviously, having mosaic Down syndrome as well as being on the autism spectrum can be complicated. The good thing is with mosaic Down syndrome, they don't have severe Down syndrome. So they can actually survive and be near to normal. So you just need a lot of support. That's what I think. And it would be nice for you to get the help that you need. We run a general pediatric service, which is an outpatient service at Mulago. And we don't have necessarily a Downs clinic, but we have a clinic that would help to support and identify any coexisting conditions for your baby. I know that Dr. Kathy Aboy is here. She's a psychiatrist, a child and adolescent psychiatrist, and she runs a clinic every Monday. But we also have a neuro clinic on Thursday, where we have 2 senior pediatric neurologists who support the clinic. Now, in terms of Sandra's question, the adolescent clinic sees children 10 to 19, and we are able to retrospectively diagnose any child who may have autism spectrum disorder. But we work as a team. If we find that the child has anxiety or depression, or even excessive anger issues, we would then send them to a psychiatrist or even a psychologist. For Nina, there's no relationship between C-section and autism. Like we've said during this conversation, autism causes are not known. They may be genetic, but people are still trying to find out what actually causes autism. If you have a set of twins, it doesn't mean that they are at an increased risk of having autism. Every child should be assessed independently. I have seen one set of twins, both of whom had autism, and the mom was a 28-year-old woman. She'd gone through a lot. Her husband was beating her and claiming that the autism had come from her family, but she needed a lot of counseling. The twins are now 3 years of age, and they are being supported through our ped psychiatric clinic as well as a neuro clinic. And mom is getting a lot of counseling, so she's more capable of supporting them. At this point, I want to thank Dr. Prossy Nakanwagi because of the personal experience you've shared and the efforts you've made to support Matthew. Thank you so much for sharing your experience and also for the efforts which show that you are a special parent. And any parent with a child who has any form of disability or inability should know that they are a special parent. So parents, don't give up. Get the support you need, whether it is through counseling, through more education, but prioritize your child. Be their advocate and be their source of strength. Thank you.
Thank you so much, Dr. Sabrina. We'll have room for 3 more questions for Dr. Sabrina. I'll come back to you now, Ngovi. I believe you had a question to ask, but there's someone that had interrupted. And then we'll get to Damali Mirembe. And we'll find the 3rd person. Ngovi, please.
Oh, thank you so much for the opportunity. I'm a mother to an autistic child who is 3 years old. And my question is about speech. I would like to ask Dr. Sabrina, is it that all autistic children will be able to speak at a certain time T, or some fail, like for life? I'm so desperate about that. Thank you.
Thank you, Vikula. Then we'll move on to Damali Mirembe.
Hi, everybody. I'm so thankful for all of you and for Dr. Prossy for sharing her experience. My question is, I'm a mother to a 5-year-old autistic child. I've had several therapies and different things, but my concern is like potty training. Is there anybody on the forum or the doctors? Is there any tricks that I can use to be able to potty train her? It is something that breaks my heart that she just has to go like in her pampers and she hates it. So if there's any help, I'd really appreciate it. And I thank all of you for organizing this. It's truly eye-opening and to know that I'm not alone in this.
Thank you, Damali. I don't know if that question was to Dr. Sabrina or Dr. Prossy. Okay, but I don't know if Dr. Sabrina, are you comfortable with responding to that? In the meantime, we can go on to Philip and Rose. You have your hand up. That's the last question for Dr. Sabrina.
Good morning. I mean, good afternoon. Thank you for the presentation. I don't know if this question is to Dr. Sabrina or Mama Matthew. I have a 4-year-old who is autistic, Elijah, and we've gone through therapy for ourselves, and I think we are getting there. However, I just wanted to get some advice on how to increase his speech. He says 1-2 words. He can recognize things and say them on his own. But how do we encourage conversation? How do we move from the 2-3 words to a conversation? How do we encourage that at the current state? Thank you. Thank you.
Oh, sorry, we'll have Dr. Sabrina answer the question.
Yes, thank you so much for those questions. I'll take the speech questions together. And I want you to know, dear parents, that it's not going to be one thing fixes everything. It's very important for us to practice maximum patience. And yes, work with a speech therapist, but also like what Prossy shared, and I'm sure she's going to share more, stimulate the child to be able to speak. They are not deaf, they are not unable to speak. But like I said, if a child is not able to talk, for us as pediatricians, the first thing we do is assess their hearing, because you don't want to be stressing a child who is not able to hear and you're forcing them to speak. Children have between mild to moderate to severe hearing impairment, and you cannot learn how to talk when you cannot hear what people are saying. So the first step is do a hearing assessment. If the hearing assessment is normal, then you continuously stimulate their verbal ability, including having children around them, having a conversation with your child. Don't stop talking to them. For the potty training, parents have asked, how soon should we start potty training? And one thing I'd like to tell parents, please do not stress your child into learning how to be well potty trained. Children on the autism spectrum disorder can have mild to moderate to severe autism, and that we need to understand. If a child is stressed during their normal physiological release of excreta, they are going to have a fight with you as a parent. If you're forcing them to use a potty, if you're forcing them to excrete at a time when you want them to excrete, it's going to be difficult. Softening their food, making sure that they are comfortable when they are using the bathroom, giving them the privacy that they deserve, ensuring that potty time and even feeding time is a joy and not a stressful factor is going to be extremely helpful. Yes, children on the autism spectrum disorder spectrum are likely to use their pampers for a longer time, but with time, you continuously train them and encourage them. The point here is encouraging them. I have seen Mr. Henry Seremba making a comment. Thank you, Henry, for sharing about your 21-year-old who has autism. And I truly appreciate all the efforts that you've gone through to support him.
All right, thank you so much, Dr. Sabrina. Unfortunately, we will not have more questions. I would love to, respond to all your queries, but in the interest of time, we will have to move on to Dr. Prossy. But in the meantime, please be reminded that we will have these sessions every month. The next one will be on the 28th of August, 2021, and we will share, details about the session. We hope you will still come back. We've loved having you here. And also, I've been posting in the group chats. If you would like for the presentations and the recording to be sent to you, please type in your email, and we will send this by Monday. If you do not receive an email by close of business on Monday, please reach out. That means maybe I was not able to capture your email. And then also I've seen people asking about supplements and different toys that would be beneficial to children with autism. We do have some in stock as Autism Care Uganda. If you would also like, please visit our Facebook page. We have a virtual shop there where you can see the different kind of products we have and their prices. So please visit Autism Care Uganda on Facebook and just look at some of the products. They're already displayed there. Yes, so we'll move on to Dr. Prossy. If you have any question for Dr. Prossy, please raise your hand, or yes, we have Florence Nachito, please go ahead.
Good afternoon, and thank you all for the presentation. I hope you can hear me. Can you hear me?
Yes, we can. Yes, we can.
Oh, okay. So my question for Dr. Prossy, I have a nephew. He's 9 years old and he's autistic, and he does the different therapies like she walked through. He does the occupational and the speech therapies and all, and he has a school that he goes to that handles those therapies. But a challenge that we have, okay, from the school reports, we usually get encouraging feedback on his gradual improvement. But the challenge we have is this knowledge being transferred at home. When he comes home, it's like he's compartmentalized too. School is where you do this, and home is where you basically just have fun. We have tried to have the therapists coming and having some of those sessions at home, and also like what Dr. Prossy said, trying to pick up those same things at home, but he has that compartmentalizing. I wanted to know if she has any other maybe tricks that she can share or insight on how to be able to get him to transfer knowledge from his therapist to his daily activities at home and outside school. Thank you.
Sorry. Thank you, Florence. We could have the next question for Dr. Prossy. Anyone else with a question?
Hello.
Yes.
My name is Juanita. I'd like to understand how the development or lack thereof of the autistic child affects the siblings who follow that child, especially those who are not autistic. And how does it affect their own development in terms of what they can learn from the sibling they're following, and how can they be taught to deal with their sibling who's autistic?
Thank you, Juanita. And then the third question for now, Galaxy S8 Plus. This is why we're asking for people to display their names. Galaxy 8 Plus, your hand is up.
Hello.
Okay, we'll go to Annette and then
Okay,
we can go Galaxy S8.
Yeah, I'm called Annette. Can you hear me?
Yes, Annette, we can hear you.
Okay. I'm called Annette. I'm a mother to an autistic 6-year-old daughter. But then she's under therapy. Although I have a serious problem, which has failed to go away for now like 2 years. My daughter, when she's speaking to herself, she has a habit of speaking to herself and also speaking to dolls and speaking to pets. And when she's speaking, she's clear. Like she can tell that doll, go to sleep. Let me give you the cloth. This is not good. Let me give you this one. Let's play together, something like that. But then when it comes to me or any other human, like a human being, a grown-up person, you can ask her, Adrian, how are you? And then she says also, how are you? She has what they call echolalia. Is there any way that we can change a bit? Maybe I can talk to the therapist and then we change a bit and then that echolalia goes away?
Okay, I hope.
Hello?
Yes, we can hear you. I hope Dr. Prossy has noted that. We can hear you. We can hear you. Yes, I hope Dr. Prossy has noted that question. So we'll just have 2 more questions. and then we close the Q&A so that Dr. Prossy responds to them, and we end the meeting. Questions so much into your time. I don't want to encroach on your time. It's a Saturday. So 2 more questions and then question.
Yes.
Go ahead. You can
yes, okay. I want to thank all the facilitators for the day and for what they have shared with us. Now, my concern is about maybe a parent who is not able, because I've seen the way Dr. Prossy has mentioned the way she took care of her child, Matthew. She was really so determined to make sure that the child is able to come back to normal. But now, what about this parent who is not able? What can we say about this parent? Because if you don't have this money, if you don't have enough resources to bring or to help this child, what can we say about it? Because I know many are suffering outside there in the field, and they would want to bring back their children. They would want to give them this love and care and to show them everything that the child needs. That's my challenge. How can we help such a parent?
Okay, thank you. And then we'll have Annette. I think you had a question and then you dropped off. And then lastly will be Rita Maraka. We will not take any more questions after that. Annette, are you here with us now?
Yes, I'm here. Can you hear me now?
Yes.
Yeah, I was asking that I have my daughter who is she's an autistic daughter. She's 6 years old. But then when she's speaking to a pet or a young kid, or like she speaks to herself, the words are so clear. Like she can say, okay, let's go to bed, to a doll. Okay, let's go to bathe. Like the words are so clear and you can really understand them. But then when it comes to a human being, or like me, her mother, you can ask her a question and then she repeats the same. She has what they call echolalia. Is there any way we can intervene? She can be intervened and then that thing of echolalia goes away?
Okay.
Hello?
Yes, I believe we've got your question, Annette, and then lastly, Rita Maraka.
Thank you so much. I don't know if all of you can hear me. I'm out and about, but I made sure I'm part of this program. Yes, my question is, I've got a 10-year-old who is actually 11-year-old who is autistic. But with me, I never look at her age and act at that age. Much as she's 10, I'm looking at an 18-year-old or a 15-year-old soon. Much as she's 11, sorry, I'm looking at her starting 12, 13, 14. So then I always prepare ahead. One, I understand she learns very well when she looks at cartoons, because cartoons do motions and less talking. So she'll kind of understand the message. But if some speech is involved, because she has speech problems, she never gets to understand it. So if I need to teach her anything, like periods or something, I go and look for a cartoon that can tell her, soon you're getting periods and we'll be using pads. So I use that. It's the same as boobs. I kept telling her, soon you're going to develop boobs. So I would show her mine, and then she feels my boobs, and then I ask her, what is this? Then she says, boobums. I say, okay. And then I ask her, mommy boobums big or Kelly boobums small? Then she will tell me hers are small, mine are big. So in there, I'm training her that soon yours are also going to be big like mine. Now we are at the stage where I'm predicting periods. She'll be 13, 14, whichever age they will come. And I'm using pads. I bring her pads. She pads toys. She pads everywhere. She pads everything. reason, I want her to get used to the pad and the panty because soon she's going to be wearing it. My question here is, in London here, I've seen moms that have struggled, that have boys that are erecting. It's easy for a mom to train a girl or tell them of those body changes because you're a mom, you go through them, so you can kind of help your daughter out. Now, there are single moms there that are having boys that are erecting, and some are walking naked on streets without, with their willies out there. I'm asking doctors, how can they help us parents teach our children about the body changes that they go through? What tips are there? Thank you.
Thank you, Rita. Hello, please. Okay, thank you. Thank you, Rita, and Annette, and all the other people that have given in their questions. Let's give the floor to Dr. Prossy to respond to those questions. If there is room, we can have maybe 2 more because there were some in the chat room. But for now, let's respond to the 6 questions, and then I don't know, there were 5 or 6, and then we can see how to move forward. Dr. Prossy, the floor is yours.
Hi, one
Thank
second,
you very
Dr.
much.
Prossy. Dr. Prossy, if I could interrupt you just briefly.
Okay.
Okay, so in the interest of time, let's just give you the 2 questions that are in the chat room so that you can speak about everything at once. Huh? The question is, how do we get our spouses to be part of this journey? I notice here we are mostly mothers. And then another person is asking about evidence-based interventions. Thank you. Over to you, Dr. Prossy.
Thank you very much for the questions. Before I go into the specific ones that were addressed to me, I would like to go back to the potty training one. Potty training is actually a challenge to many, and most of these children are very visual. So sometimes you will talk about it and they will not understand. Having the physical potty there, but also having a picture or a video demonstrating how to use a potty may help. There are instances where parents, when Matthew was younger, there's an instance where would even attempt to sit on a bucket to demonstrate that it's okay to sit and do what you have to do, okay? Then there are others who will actually really not use the potty, and trying a pit latrine could help, yeah? So you just have to keep introducing different aids, yeah? I mentioned their visual, get the physical potty explained, but you can also have a video or some cartoons and yeah, a writing on the wall that this is what is expected. Number 1, remove pant. Number 2, sit. Now, like simplifying it for them. Many times it helps. And also be very, very patient. If you're like Dr. Sabrina mentioned, if you're very apprehensive and you're forceful, some of them actually will just choose not to do what? To pass their stool. They'll retain it, okay? Because they are confused and also concerned that you're harassing them. Many times they see things in a different way from us. So Florence, you mentioned that your 9-year-old nephew is having challenges transferring skills. This is also the other challenge, because they know that at school, they do particular things, and at home, they're expected to do particular things, okay? In a way, they are right. Home shouldn't be a school, but that there are home activities that you could do that are sort of different from what they do at school, but they're appropriate for home, yeah? I remember a time when Matthew refused to write at home because he would say, no school, Matthew at home, okay? So sometimes you also have to walk through their mind, think about what they are thinking about. When you were younger, did you want to do a lot of homework at home? What makes you think that they want to be busy all the time? Can you change the activities? Can they be focused? Like activities that you could do at home, but through those activities, you're teaching them something. For example, at home, there is housework. okay? Can that be an activity that you're doing? And at home, if, for example, you choose to read, can it be just brief? Can it be around play rather than very structured, okay? Children are different. Personally, I also don't like a lot of structure. My friends know that I don't like a lot of structure. Maybe he's that type of person. He knows he's done with school. It's been stressful. He needs a minute or two to himself and to enjoy his home. So find ways of, I mentioned, find ways of making them happy, okay? It shouldn't just be about the learning. Can we meet them at where they are? What is it at home that they can do and do well? It is not true that the most successful people, the most wealthy people are the ones that know how to write a lot, or they are the doctors or the nurses or the engineers, okay? What is it that they can do? So I hope, Florence, that sort of answers your question, okay? Then to Joanita, you asked how how having an older child with autism would affect the development of the rest of the siblings. As I don't know if it came out, but one of the risk factors for autism is a firstborn male. If you have a male for a firstborn, the risk is much higher, okay? So usually they are the firstborns and they are the ones with autism. So the younger ones, especially when the siblings are much younger, they've not yet differentiated right from wrong, they are likely to copy. That is for a fact. Because, you know, when we are young, we copy what is in our surroundings. So I remember when my daughter was maybe 2.5, she used to do things that were not expected of her. She would go and sit down in the mud just because Matthew was doing it, okay? So with time, as they grew older, we actually had to explain to them that you're not expected to do this and the other. Don't copy Matthew, okay? Then as they've grown older, we have continually explained to them that yes, Matthew may be doing this and is your older brother, but you don't have to copy him. On the contrary, you're supposed to step up. Like for the two, that is my daughter and my last son, I tell them that they have to model right behavior and Matthew has to copy them instead. So as they grow older, they actually understand that. But when they're young, it's kind of a challenge, something that is not going to go away immediately, but with a lot of explanation and that improves with time. So don't worry, along the way, things will fall in place. Okay, that is for Joanita. Annette, you mentioned that your child speaks to the doll and they speak very well. And I'm glad you already know that that's echolalia. So echolalia can be immediate or delayed. It appears like you have both. You ask them, how are you? You greet, how are you? And they answer, how are you? That's immediate, okay? Echolalia. The delayed one is one that comes much later. It's like they're narrating a story of maybe a movie they watched or something. So usually that is a problem. I still struggle with echolalia, yeah? So I cannot tell you that it will go away tomorrow or the other day, but there is hope. How do you do it? Normally, if, for example, you greet her, I don't remember whether you mentioned your name, rather your child's name, but for example, if I say, hi, Annette, and they say, hi, Annette, for you, you're expected to give them the right answer, say the right answer. For example, I say, hi, Annette, and then you answer back, I would say, hi, mommy. So with time and a lot of practice, it gets better, it gets better, it gets better. Even with the delayed echolalia, the same. They actually say that usually you want to reduce what is bringing the delayed echolalia. And this is usually from TV. They've watched a lot of things and stored a lot of things. While I want to agree, sometimes it's not even what they've watched, because now I'll tell you that Matthew sometimes also has that, okay? But number one, be of good cheer that at least they can say something. You have somewhere to start, okay? There are parents on this forum and somewhere else where there is no word. It's just a quiet child looking at you, if you're lucky that they're looking at you, okay? So with echolalia, you want to say the right thing, you know? Maybe you hear them say, oh, the cartoon, go here, then you interrupt them, you know? You join what I mentioned about joining in. Say, oh, you mean teddy bear needs to sleep? Okay, teddy bear goes to sleep. Usually if you interrupt, okay, or join in, they don't want you there. So they sort of realize what it is that you want them to do, okay? For you, your duty is to continue doing the right thing, okay? So if they are saying this and the other, and you think it's not something that they should say, you say the right thing, but you say it in a different tone, okay? Like you're answering yourself, hi, Annette. And maybe they're answering back that, but you'll say something like, hi, mommy, in a different tone. So with time, it's thought that it will do what? It would help with that. It would help. 2 years, you mentioned it's 2 years. 2 years, yes, it's a long journey, but not too long. So continue on. You are on the right track, and I thank you. Then Sister Clementine, you're concerned that there are parents who may not be able to afford. Indeed, these therapies come at a cost. And that's why in one of the, at some segment of the presentation, I said that if there are therapists on this call, we urge you to be mindful that parents are on a journey, okay? I remember when we used to do therapy, at some point, these sessions are much more expensive than what, for example, a specialist doctor would charge. Okay, so maybe we also want to use this forum to really beg and ask the therapists to know and be mindful that this journey is expensive in its own. That is one. Number two, even when the therapies are maybe cheaper, maybe some parents will not be able to afford to pay for many or to pay even for one. I mentioned that there are things you can do at home, okay? You use the available resources. For example, many people can afford, maybe you're in a home situation, you can learn a few things. Play is free. I told you I formed a play group at that point. I didn't have to pay for the children's time. What I did was sing nursery hymns, you know, to these children. We jumped, we danced, you know. If it is toys, there are things, actually, I remember we bought very many toys, but toys is not the answer. The toys are not the answer. What you do with the toys, okay? In the home, there are cups, there are plates, there are chairs. You can use that. Giving your time to this child will go a long way. Okay, for those that can afford sessions, I encourage you to sit in. You learn a lot. Many times, I think you'll not disagree with me. They are human beings. That is number one. Number two, they are speaking a language that you know. Number three, they are not using rocket science. They are using principles to connect. Okay. First of all, you want to improve their eye contact and concentration. If someone is not concentrating, they will not learn. There are things that can be used to improve concentration, even at home. Yes, you're playing with this child. We said occupational therapy is to improve life skills. What life skills do you want to impart in your child? Earlier on, maybe when their hands are not working well, you can do a ball. You can do balls out of fibers. I remember we used to do balls out of fibers, out of milk, pints, empty pints, okay? You tie them with whatever.
what are those things called? Rubber bands. Then you let your hands, their hands squeezing. You're improving their hand movements. Okay. Usually many people can afford a ball. If you can't afford a ball, you can make a ball. Play with the ball. Many times it may be they can't play football. What can you do with the ball? Are you able to just throw the ball, but show a lot of interest in this child? Okay. Tell them, oh, you're doing a good job. Can I play with you? Running. How much will you pay for running with a child? Run with them. By running with them, normally, by the way, children on the autism spectrum disorder, they like running games. But don't just run kapal or just aimless running. Can you put in some, can it be a bit objective? Okay? Can it be intentional that you're teaching them something? As you run, maybe jump. Okay? As you realize, up to now, we've not paid for anything. If you have internet, you have connected because you have internet. Read. There are YouTube videos to demonstrate a few of some of these therapies. Okay, just understand what it is, the underlying principle, and run with it. Water play, for example. Get a basin of water. Get the water. Pour at them, let them pour at you. I don't know how many parents would want that, but get wet, get playing, engage them, okay? What else can you do? Someone asked about speech. So speech is not about talking. There's a lot of brain work involved. While it looks very simple, but there's a lot of coordination. The brain needs to know that the word needs to come out. But then there are also speech muscles, the facial muscles, and the muscles around our mouth, okay? Sometimes even strengthening those muscles can go a long way to help. And there are simple things like blowing bubbles, drinking from a straw. Many parents should be able to afford a straw, okay? This child drinks through a straw, you're massaging around the mouth. I mentioned personally, I used essential oils. Essential oils, if you chose, for example, one bottle can take you for months. You just put even a drop in cooking oil and you have your massage oil ready and you actually do the massage. So first of all, we have to change our mindset that we have to change from government to yambe, let the government help us, to a mindset of there's something I can do. Okay, there's something I can actually do for my child. Okay, then Rita, you talk about your child and how you've been able to train them through the animation. You are actually doing a very, very good job. I commend you. Okay, and for parents, just maybe get a YouTube video, show these children. If they cannot read, if they cannot talk, many times, by the way, they can read. So I remember an occupational therapist earlier on advised us to write the words. So as I showed Matthew later banana, I showed him the word, you know, and it was amazing that there are words that he read, you know, he knew before he could speak them. So you have to sort of use different avenues to reach your child. Okay? We need to reach these children. So it's good that you're using those different avenues. Cartoons, we too, with Matthew. Matthew is very visual and he watches more animated movies than I can do. So for a mother, a single mother who has a boy, I want to say that I feel for them, but I want to imagine that there are males in either friends or family who, if they are informed about the challenge, maybe they can step up and be the man in this child's life. Okay, because it's difficult to discuss certain things, especially boys, by the way. With time they grow and they don't want to interact with you in some ways. Like for me, when Matthew is in the shower, I cannot go there. Just says, shut the door, I am bathing. Okay, so you're not going to go against his wishes and enter. So if it is possible, you can work with, number one, a therapist, a male therapist, to guide them through that journey. Okay, many times they can be taught, like I mentioned, with patience and a lot of love, they can be taught. Okay, they can be taught to do certain things in particular spaces. For people with younger children, it wasn't a question. Try to connect with your child early on, such that when they are older, it will be easy to connect with them and to direct them, because you will not let them grow when they are 12, when they are becoming teens. That's when you're showing up to tell them, put on your clothes or do the other. If you've not connected, it will become very, very difficult. Okay, it will become very difficult to reach out to them. I think those are the questions that were given to me.
All right, thank you so much, Dr. Prossy, for responding to those questions. And unfortunately, we will not be taking on any questions. We've stretched to 3 hours for a meeting that's supposed to be for 2 hours. But that shows how much interested people are in the topic, and also just creating awareness on autism, how parents are desperate to create the best environment for their children. So we really appreciate you putting your time aside. We appreciate you putting all the things that you had to put aside. We know it's a weekend, but thank you for making the time. So on behalf of Autism Care Uganda, I wish to thank our dearest speakers for the day, Dr. Sabrina and Dr. Prossy, for your time and the inputs made during the conversation. It is our hope that these inputs made will shape national and global conversation on autism, and to create more awareness and support towards autism spectrum disorder. For our viewers, to our participants, thank you all for the inputs you made and taking your time off your busy schedules to join us and to support the cause of autism awareness. Thank you all for coming. Stay safe, stay blessed. As we say, these conversations are every month. The next one will be on the 28th. Just follow our social media channels to be updated on the next events, and also where we share information, as well as joining the WhatsApp group for the parents support group for Autism Care Uganda. Follow us on Facebook, Autism Care Uganda, on Twitter, Uganda lower score autism, and Instagram, Autism Care Uganda, and LinkedIn, Autism Care Uganda. But we are more on Facebook. Like I said, we also have a virtual Facebook shop there. Thank you all so much. Thank you for your time, and thank you to our guest speakers once again. And have a good weekend, rest of the weekend. See you in the next meeting this month, coming month.
Thank you.
All right, our meeting has ended. Please feel free to leave.
Hi, 1 second. Dr. Prossy, are you still available for a few minutes? She's gone off, eh? Okay, I see so many questions. I was going to ask her to say something.